baby is born. So therefore, there's going to be areas that are not ossified in a baby's skull, and those are called fontanelles. Fontanelles right here. The common name are soft spots. That they're fontanelles is the correct name. And there's two functions for that. One is to allow for the brain growth, and then two is to allow in the ease in birth. And so when the baby is coming out of the vagina, then sometimes some of those bones will actually overlap one another, as from the pressure of the vagina, the baby is being squeezed down. And so sometimes babies are born with low pointed heads because of that. Okay, so the fontanelles are named according to the bones, and that's how I learned them. You can also learn them by direction too. Okay, so here's your frontal fontanelle, sphenoidal, mastoidal, occipital. One in the back. So frontal, sphenoidal, mastoidal, occipital. Or you can have anterior, posterior, anterior lateral, posterior lateral. So you can do that by direction too. Okay, any questions on the fontanelle? Make sure you're able to know them on this fetal skull here. You're able to label them, and make sure you know the functions of the fontanelle.
What was the function again? Sorry.
They're for the ease in birth and for brain growth. They're listed on your yellow sheet. If you look under fontanelles on page, which I assume that all of you read this during your leisure.
It's on the front.
Of course, on page 5, it tells you about fontanelles. And it tells you, and it gives you the two functions in bold. So if you read on page 5, you'll see them. Okay? See them, everybody?
Yes.
Do not neglect to read this yellow pages. Thank you. You might miss something. Okay. All right. Sheena, when I finish here, your scantron is due. Okay, we're going to go to the regular skull. So at the top here we see the bones, the frontal, parietal, occipital bones. And now you are actually going to have the sutures which are formed. So the bones have ossified by the time you reach, actually, even before you reach adulthood, the bones have ossified. But not all the sutures will ossify. Some of these sutures will not ossify completely until in your mid-30s. So that was one of the hints on your scantron sheet. Okay? So here's your coronal suture, sagittal suture, lambdoidal suture. And this one looks like the Greek symbol lambda. And sometimes you might actually have a suture right here that runs down here, and that's called a metopic suture. Metopic suture. But most people don't have a metopic suture, but there might be one that runs down the middle here. But the ones that everyone has are the coronal suture, sagittal suture, lambdoidal suture. That's right. Okay, and so here, whoops. So here you see your lambdoidal suture here with your occipital bone, your parietal bone. External, and here's the back here. External occipital protuberance was one that you need to know. In the male, this is very prominent. In the female, it's much less prominent, and that's one of the things they use to set the skull. There are a number of other things that they use, but that external occipital protuberance is one of them. Another thing that they use to sex a skull, usually the superciliary ridges that hold the eyebrows right here are fairly heavy, and in terms of in the male versus the female, that's something else to deal.
What do you mean by heavy? Like
heavy, they actually are heavy. They hang over a bit more. Yeah.
Oh, okay.
So the bones actually protrude out more. Okay. And okay. So here you have your frontal bone, your two nasal, your zygomatic, which is your cheekbones, upper jaw, maxilla, lower jaw, mandible. And in the frontal bone, you have your frontal squama, glabella, which is in between your eyes. Where the eyebrows sit is called the superciliary ridges. You have a supraorbital foramen above the eye orbit, infraorbital foramen below the eye orbit. In the eye orbit itself, you have a number of bones. You have a lacrimal bone right here with a tear duct lucidity. Then you have 3 openings in the eye orbit. You have an optic foramen, superior orbital fissure, and an inferior orbital fissure. In the nasal cavity here, you have your nasal septum. The one above, the higher one is called the perpendicular plate of the ethmoid, and the bottom is called the vomer. Then you see 2 of the nasal conchae Out of the three, you know the three, they're superior, middle, and inferior nasoconchi. You can only see the two because the superior is way up here, and you can't see it on your skull. So you only see the inferior nasoconchi and the middle nasoconchi. Okay? And then in your zygomatic bone, you have a zygomatical facial foramen. In your maxilla, you've got your infraorbital foramen that I mentioned earlier. Intermaxillary suture, you have a hair lip if that doesn't close. Alveolar margin or process that holds the teeth on both the maxilla and the mandible.
On the foramen, up here on your maxilla, what's going through there?
It tells you on your yellow sheet.
Oh, I
Yeah.
thought you were telling me. It's just
Oh, wrong one. One of the branches of the cranial nerve, trigeminal. Repeat it. Okay, then when we turn on the lateral side of the skull, you're going to have your squamosal suture right here, your temporal squama, mastoid process, externoacoustic meatus, styloid process, your zygomatic arch. Here is the suture between the zygomatic bone and the temporal bone. This is your temporal process of the zygomatic bone, zygomatic process of the temporal bone. Together they make up the zygomatic arch. On your mandible, you have your mental-foramen, mandibular angle, mandibular notch, coronoid process, condyloid process forming the temporal mandibular joint. Then you also have you have lines up here, temporal lines that are there, and that one. And then when you look on the inside of the skull, you have your ethmoid bone, the sphenoid bone, the temporal bone, the occipital bone. And right here you have the cristigale, which is a sharp part. It means a coxcomb, because it looks like it's the early anatomist, like it belongs onto a male chicken. And so this is the one where they teach you in defense to push up right here and forces it into the brain to stop the person, cristigale. Then it is surrounded by a cribriform plate. So any of you that play cribbage know that there's some sort of board with holes in them with pegs, and you kind of move them. And so that's what it reminded early anatomists of, with the cribbage board. So cribriform plate, and there are holes in there called olfactory foramina, which the first cranial nerve will pass through. Okay, then in your sphenoid bone right here, you have your lesser wings and your greater wings. Then you have an area called the sella turcica, Turkstella. Parts of the sella turcica include the optic chiasm, in which the two optic nerves will cross at the optic chiasm. These are your anterior clinoid processes. The back of the saddle is your posterior clinoid process. In the middle is the dorsum stelli. Where you're going to sit in the saddle is the hypophyseal fossa, where the pituitary gland sits. And then you have your foramen rotundum, which is an opening here. Then for your temporal bone, you have your petrous portion, which means rock. And in the petrous portion, you have your internoacoustic meatus. You also have right here the carotid groove, the internal carotid artery. After it passes through the carotid canal, will come and lay along here. We'll dip a little bit into the viscera before it goes up and into the brain and divides through your two cerebral arteries. The brain is going to sit in this area right here, so you have your anterior, middle, and posterior cranial fossa. Then on the inferior side of the skull, you have an opening called the incisive fossa behind the incisors, a median palatine suture, so you have a cleft palate when that doesn't close, a transverse palatine suture. This is called the palatine process of the maxilla, horizontal plate of the palatine, greater and lesser palatine foramen, vomer, that made up the perpendicular plate of the ethmoid, the pterygoid processes, the P is silent, pterygoid. Right here, the P is silent, it means wings, pterygoid. The foramen lacerum, foramen ovale, I don't think they showed the foramen spinosum, foramen lacerum, carotid canal, jugular foramen, styloid process, mastoid process, stylomastoid foramen, right there, foramen magnum, which the spinal cord passes through, occipital condyles, which is articulated with C1, the condylar fossa, external occipital protuberance, nuchal lines that be along here, mandibular foramen, mandibular fossa, in which the condyloid process of the mandible would sit on that. I think that's it. I've got a picture of the mandible, I don't have a picture of the mandible. But I'll do it when I go around and show you. Any questions? From table to table.